So you're thinking about heading to Sikkim, huh? I am so jealous. I mean, those mountains, the culture, the food. But, have you thought about, like, what happens if you need to see a doctor while you're, navigating those Himalayan roads?
Yeah, that's not usually the first thing on people's minds when they're planning a trip to a place as incredible as Sikkim, but it's definitely something to consider.
Right. And that's exactly why we're doing this deep dive into Sikkim's healthcare system, so you can feel prepared and confident.
Absolutely. We've been poring over reports, articles, even some personal accounts, just to get a really good understanding of what you can expect when it comes to healthcare there.
While I was prepping for this, I was really struck by the sheer dedication of Sikkim's healthcare workers. I mean, they're facing some truly unique challenges.
Absolutely. And they've accomplished a lot, especially when you consider the terrain.
Oh, yeah, those mountains.
Right.
I can't forget about those mountains.
Exactly. So just to start with the basics, Sikkim has a three-tier healthcare system, like many countries. It's structured with different levels of care.
Okay, 3 tiers. So kind of like climbing a mountain itself. What's at the peak?
At the top, you have what's called tertiary care. That's where you find the most specialized services and facilities. Think of it as the summit of healthcare in Sikkim. There's the STNM Hospital.
STNM.
That stands for Surthutab Namgyal Memorial Hospital. It's the main government-run referral hospital, Gangtok. And then there's also the Sikkim Manipal Institute of Medical Sciences, which is a private option that offers some more advanced care.
Got it. So those are the big ones, the top tier. Okay.
Exactly.
So it sounds like a pretty solid foundation for a healthcare system, right?
It is. But here's where it gets interesting. Remember those mountains we talked about?
Always.
They play a huge role in how the system actually functions. Imagine meeting a heart specialist, but the nearest one is a whole mountain range away. That's the reality for many people in Sikkim.
Yeah. I can see how those mountains would create a healthcare hurdle, unlike any other.
Definitely. And because of those limited specialized facilities within the state, most critical cases actually end up being referred outside of Sikkim to places like Kolkata, Delhi, or even Siliguri in West Bengal.
Wow, that's a pretty big catch. It's great to have those top tier hospitals, but if you can't even get to them or if they don't have what you need, it kind of defeats the purpose, right?
That's exactly.
So let's climb down from that summit to that second tier you mentioned. What's going on there?
So that's where you find the district hospitals, which provide secondary care. They're in places like Namche, Jelshing, Mangin, and Singtam.
Okay. So kind of like base camps for healthcare, strategically positioned throughout the state.
I like that analogy. A good way to think about it.
And then at the base of the mountain, you have the primary healthcare network.
Right. With the 147 primary health centers spread across Sikkim, they handle the more basic needs like, vaccinations, checkups, common illnesses.
Sounds pretty comprehensive on paper. But I can imagine that, like, actually reaching people in those remote villages must be a real feat.
Absolutely. That's one of the biggest challenges Sikkim faces. Getting healthcare workers and supplies to those areas, it can be incredibly difficult.
So even with this 3-tiered system, the mountains are still kind of looming over everything?
Yeah, they're a constant factor. But, despite those geographical hurdles, it's amazing what they've been able to achieve, especially when it comes to maternal and child health.
Really? That's good to hear.
Yeah, they've managed to significantly reduce maternal and infant mortality rates in recent years.
That's impressive.
It really is.
But, I mean, I imagine keeping those healthcare workers motivated and equipped in those remote areas must be like an uphill battle all the time.
Yeah, it takes a special kind of dedication to provide care in those conditions. And, brings up another interesting point. How is the government actually supporting healthcare in a state with such unique needs?
Right. That's a great question. What kind of safety net are we talking about here?
For starters, there's Ayushman Bharat.
Okay, I've heard of that. That's the big national health insurance scheme, right?
Exactly. It aims to provide coverage to the most vulnerable sections of society.
Yeah.
And then you have the Chief Minister's Free Medical Scheme, which is specific to Sikkim.
So kind of like a double layer of protection.
Exactly. And both of these programs offer pretty generous coverage, like up to 5 lakh rupees per family per year.
5 lakh rupees. That's incredible, especially when you're, potentially facing those extra travel costs we talked about.
Absolutely.
It sounds almost too good to be true. What's the catch?
Well, there's always a catch, right? Remember how we talked about the lack of specialized facilities in Sikkim?
Yep. Still thinking about those mountains.
Right. Well, that comes into play here. Even with this incredible coverage, many people end up having to travel outside the state to actually use it.
Oh, so it's a bit of a double-edged sword. It's great to have that financial protection, but it doesn't really solve the problem of accessing the care you need within the state.
Exactly. It highlights a really crucial point about healthcare. It's not just about having insurance or hospitals. It's about having the right kind of care available at the right time and in the right place.
Couldn't have said it better myself.
And, it makes you wonder, providing universal health care through these schemes, while incredibly noble, might also be putting a strain on an already resource-limited system.
Yeah, that's a valid concern. I mean, access to care is considered a fundamental right, isn't it? So
Yeah.
how do you balance those needs when resources are stretched so thin?
It's a complex issue with no easy answers.
Definitely.
But it's a conversation that's happening all over the world as we try to figure out how to, create sustainable and equitable healthcare systems.
So we've got these big government initiatives trying to make healthcare accessible for everyone. But what about Sikkim's unique approach to traditional medicine? It seems like they're blending the old with the new in a really interesting way.
They absolutely are. And that's what makes their approach so fascinating. They're actively promoting AYUSH, which stands for Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Homeopathy.
Okay, that's a mouthful.
It is. It is. But these are traditional systems of medicine that have been practiced in India for centuries.
Right, right. So it's not an either situation. They're embracing both modern and ancient practices.
Precisely. And here's where it gets even more interesting. Sikkim is the only state in India with a predominantly Sikkimese Bhutia population. And they've incorporated Soa Rigpa, which is the traditional Tibetan medicine system, into their healthcare approach.
Oh, wow. That's something you don't see every day.
No, you don't.
It sounds like they're really committed to creating a system that reflects the cultural heritage and specific needs of their people.
Absolutely.
Wow. It's like a healthcare puzzle with all these different pieces fitting together.
It really is.
But, let's be real for a moment. Those mountains aren't just a metaphorical challenge, right? They're a very real obstacle when it comes to actually delivering care.
Right.
We've talked about the referral system and the challenges of reaching those remote areas, but I think we need to dive even deeper into how those mountains impact every single aspect of healthcare delivery.
Yeah, let's do that.
Those winding roads, treacherous terrain, the logistical nightmares, it's a whole other story.
It is. Okay, so picture this. It's the middle of the night. A patient in a remote village needs urgent medical attention. We're talking emergency.
Yeah, and you've got to get an ambulance to them somehow.
Right, but getting an ambulance to them is not your average ambulance ride.
No, I can only imagine. Those winding mountain roads, steep drops, limited access, it's got to be a recipe for a pretty stressful situation.
You're telling me. And it's not even just about getting there quickly, It's about the expertise on board. Can you imagine being a paramedic facing a complicated medical situation with limited resources on those bumpy roads?
Talk about pressure. It really makes you realize that healthcare in Sikkim isn't just about having doctors and hospitals. It's about a whole network of these dedicated individuals who are working in some really, really challenging conditions.
Exactly. And let's not forget about the supplies, right?
Mm-hmm.
Imagine trying to transport vital medical equipment, delicate medicines, vaccines. Everything has to be so carefully packaged, secured to withstand those journeys.
It sounds like a logistical puzzle with some very high stakes.
It is.
And I'm guessing that even once you reach those remote villages, the challenges don't just stop there.
Right. The terrain also impacts things like communication.
Yeah.
Reliable internet access, which is, essential for telemedicine, can be spotty at best. And even simple things like electricity can be unreliable in some areas.
Yeah. It's like every aspect of healthcare delivery is just amplified by these geographical hurdles. It makes you really appreciate the resilience and resourcefulness of both the healthcare providers and the communities that they serve.
Absolutely. And it also highlights, tough decisions that have to be made. We talk about those critical cases that need to be referred out of state. Well, the decision to transport a patient It often comes down to a very delicate balance of risk versus reward.
A decision that no doctor or family wants to have to make.
No.
But sometimes, those mountains, they just leave you with very few options.
Yeah. And it's not just about the physical journey either.
Yeah.
Think about the financial burden on families who have to travel with their loved ones. They might have to cover accommodation, food, all that. It adds up quickly.
Yeah, it's like this ripple effect. Those mountains just cast a long shadow over the entire healthcare experience.
They do. They really do. And it brings us to another crucial piece of the puzzle here, which is kind of the doctor dilemma.
Okay. The doctor dilemma. What's that?
Would you want to be a cardiologist, like on top of a mountain?
Honestly, probably not. And I can see how attracting and retaining specialists would be a major hurdle in a place like Sikkim.
You're spot on. There's a significant shortage of certain specialists in Sikkim, particularly cardiologists, oncologists, and neurologists.
And that shortage just kind of feeds into that cycle of people having to travel outside the state for treatment, right?
Exactly. It's a complex issue that's interconnected with all those other challenges we've been talking about,
Yeah.
Geography, resources, infrastructure. It's like this healthcare puzzle where each piece kind of depends on the other.
Okay, so we've got the mountains, the lack of specialists, the reliance on out-of-state treatment. But it's not just the usual healthcare hurdles, is it? I feel like Sikkim has some unique challenges too.
You're right. You're thinking about the rise of lifestyle diseases, right?
Yeah, exactly. Diabetes, hypertension, heart issues, these things that we often associate with more developed urban areas. What's the story there?
It's a complex interplay of factors,
Right.
But one thing that really surprised me is that Sikkim actually has one of the highest rates of alcohol and tobacco use in all of India.
Wow, really? Higher than the national average?
Higher than the national average, yeah.
Huh. I wouldn't have guessed that. What's driving those numbers?
It's a mix of cultural factors, socioeconomic conditions, even the availability of these products, But the consequences are very real. These lifestyle choices contribute directly to those chronic conditions we mentioned.
Right. So it's like they're battling on two fronts.
Yeah.
The geographical challenges and this wave of new health issues that require ongoing management, specialized care.
Exactly. And it underscores the need for this holistic approach to healthcare, one that addresses both the immediate needs and the underlying causes.
Prevention is key, right?
Absolutely. Public health campaigns, education initiatives, promoting healthier lifestyles. These are all vital components of a sustainable healthcare system.
It's about empowering people to take control of their own health,
Right.
giving them the knowledge and the tools to make informed choices.
And let's not forget about the role of the community, too. Strong social support networks. They can make a world of difference when it comes to managing chronic conditions.
For sure. Okay, so we've talked a lot about the government's role in all of this, but what about the private sector? Are they riding in to save the day?
Well, that's a great question, and the private sector definitely has a role to play, but in Sikkim, it's still relatively limited.
Why is that? You'd think with the challenges that the government is facing, there'd be more opportunities for private investment.
You would think so, wouldn't you?
Yeah.
But there are a few factors at play. First, the market size. Sikkim has a relatively small population, which can make it less attractive for large healthcare providers.
So is this a matter of scale?
Right. The potential return on investment might not be as enticing as in a larger state.
Makes sense.
And then there are those geographical challenges we keep talking about, The terrain, it makes it difficult and expensive to build and maintain facilities. And attracting qualified professionals to work in these remote areas, it can be a real struggle.
Yeah, so it's not just about willingness. There are some very real logistical and financial barriers.
Absolutely. And there's also the question of, government policies and regulations, like what incentives are there for private investment in healthcare? Are there any roadblocks that need to be addressed?
Yeah. It sounds like a complex web of interconnected factors.
It is.
But it also seems like there's potential for growth and innovation if the right conditions are created.
I agree. There are some promising developments happening in Sikkim. Public-private partnerships or PPPs are starting to emerge.
PPPs. Okay. That sounds interesting. How do they work in the context of healthcare?
Well, imagine this. You're a specialist in gang talk.
Hmm.
But thanks to telemedicine technology, you can now consult with patients in remote villages without them having to travel for hours.
That's amazing. It's like bringing the mountain to Mohammed, so to speak.
Exactly. And PPPs can also facilitate the establishment of specialized clinics in district hospitals.
Oh,
So reducing the reliance on those costly out-of-state referrals.
so it's about finding like creative ways to bridge the gap between the available resources and the needs of the population.
Right. And it's not just about technology either. Investing in training and development for local healthcare workers is crucial.
Like empowering those on the ground to handle those everyday health concerns and manage those chronic conditions.
Exactly. It's about building capacity within the system itself,
Yeah.
making it more resilient and responsive to the unique needs of the people it serves.
It sounds like Sikkim is taking this multifaceted approach, combining um, infrastructure development with proactive health initiatives and empowering communities to take ownership of their own well-being.
Precisely. It's about recognizing that healthcare isn't just about, hospitals and doctors. It's about creating a supportive environment where people can thrive.
So we've talked about the challenges, but let's shift gears for a second. Let's get optimistic. What does the future hold for healthcare in Sikkim? Like what are the long-term goals?
I mean, one thing that would be a game changer is if Sikkim had its own super specialty hospital
Oh, right here in the state?
within Sikkim.
That would be incredible.
Yeah, it's definitely a long-term goal. But, imagine having those state-of-the-art facilities right there.
Yeah, no more having to send those critical cases out of state. That would be huge. I mean, for families, and it would probably attract, some top medical talent too.
Exactly. It would really elevate the entire healthcare landscape, not just in terms of treatment, but also, research and education.
So it's a win-win, really.
Yeah.
It sounds like a big dream, but hey, if anyone can achieve it, it's the people of Sikkim. They've already overcome so much.
They really have.
Yeah.
And let's not forget about the importance of preventative care, right? We talked about those lifestyle diseases and the impact they're having.
Mhm.
Addressing those head on is crucial for the long-term health of the population.
Right. It's like that saying, an ounce of prevention is worth a pound of cure.
Hmm.
What are some of the ways that Sikkim is tackling those issues?
Well, there are, public health campaigns aimed at raising awareness about healthy habits. They're promoting physical activity, encouraging balanced diets. They're even working to reduce the availability of tobacco and alcohol in certain areas.
So it's a multi-pronged approach.
Yeah, it's not just about telling people what to do. It's about creating an environment that supports those healthy choices.
Right, right. And it's about giving them like the resources and the knowledge to make those informed decisions for themselves.
Absolutely.
It sounds like Sikkim's healthcare journey is really a testament to human resilience and innovation. They're facing some incredible challenges, but they're not letting those mountains stand in their way.
No, they're not. They're finding those creative solutions, thinking outside the box, collaborating to build a healthier future for everyone.
It's really inspiring.
It is.
Well, before we wrap up, I have to ask, what's one thing that really surprised you while you were researching Sikkim's healthcare system, something that our listener might not know?
Honestly, it was the way they've integrated traditional medicine into their approach. It's not just about, offering it as an alternative. They're actively finding ways to bridge those ancient practices with modern medicine.
Like what? Give me an example.
Well, they're actually conducting research to see how traditional remedies can be used alongside conventional treatments. They're exploring the potential of medicinal plants, and they're even training doctors in both systems.
Wow. That's fascinating. It's like they're taking the best of both worlds and creating something truly unique.
Yeah, exactly. And it speaks to their holistic view of health, right? It's not just about treating the physical body. It's about addressing the mental, emotional, and even spiritual aspects as well.
I think our listeners are going to be well prepared for their trip to Sikkim now.
I hope so.
Not only will they be able to appreciate those breathtaking landscapes and that vibrant culture, but they'll also have a newfound understanding of the healthcare landscape.
Yeah. They'll know that even in those remote mountain villages, there's a system in place, There are dedicated individuals who are working tirelessly to provide care, and there's this spirit of innovation that's pushing the boundaries of what's possible.
So as you're, trekking through those incredible valleys or sipping tea with the locals, remember this deep dive and feel confident knowing that Sikkim's healthcare system has got your back.
And who knows, maybe this deep dive will inspire you to learn even more about Sikkim's unique approach to healthcare.
There's always more to discover.
Always.
And hey, if you're ever curious about a specific aspect or have any questions, just let us know.
Yeah, we're always up for another deep dive.
Until next time, happy travels and stay healthy.